Hello, good afternoon, everybody. Welcome to this webinar on Stepping into Success, Introducing Shockwave Therapy in Podiatry Practice. So in today's session, we are joined by podiatrist and clinic owner of Complete Podiatry, Louise Kenworthy. And for those who haven't joined us before, we are PhysEquip and we supply specialist MSK technologies and provide several education opportunities online and in person. Shockwave therapy being one of those technologies that we work with, and Louise has integrated this into her podiatry practice just last year. So Louise is going to be walking us through her journey with Shockwave, both clinically and also from a business perspective. So following the presentation today, we'll do a short Q&A, just covering some of the pre-submitted questions that we've received. And if you are listening live, please feel free to submit any questions in the Q&A tab and we can answer these too. So with that, I'm going to hand over to Louise for the presentation.
Yeah. Hello, and thanks for inviting me along to talk about our journey about Shockwave. So first of all, I'm just going to talk about just what we're going to cover today. So looking at who we are, just an introduction to Shockwave therapy in podiatry practice, looking at an overview of what Shockwave is and its benefits again in podiatric care, how we've integrated Shockwave into our clinic, what challenges we've faced, and also how we've overcome them. Obviously, most importantly, the impact it's had on our patients, and then obviously the business benefits as well that it brings in and the clinical opportunities. So just a little introduction of who I am and who we are here at clinic. So we are a podiatry-based clinic in Stockport, just outside of Manchester. I've been a podiatrist for over 20 years. But we've been in our private practice just over 10 years. We've got a good mixture of MSK patients, but also just general routine podiatry treatments too. There's a team there of the three of us, myself, Alana, Victoria. And so we offer between us a good mix of clinical skills. And in clinic, we've got, all our MSK, we do use Run 3D, we use drag gate analysis, we have the pressure plate, and we also do 3D printed insoles. So we are quite a forward thinking and continually developing practice. But what we didn't have in clinic, and we're always looking at new things, was Shockwave. So we had a little look at how we can integrate Shockwave and whether it'd be something that would be beneficial for our practice. So first of all, what is Shockwave and how is it useful for podiatry? So for those who don't know what Shockwave is, just a brief overview. We've not been using Shockwave for long, so I don't claim to be an expert by any means. So I'm quite new, but Shockwave, it's a non-invasive treatment. It works by using the acoustic shock waves passing through the skin into the affected area of the tissue. It initiates an inflammatory response to the tissues that need to be treated, bringing blood supply to the area to help improve healing. We used it mainly in clinic at the moment for things like plantar fasciitis, Achilles tendonitis. It can be used for hamstring tendonitis and also knee and hip pain. So it has many uses within podiatry setting. So initially then we thought, okay, how can we bring Shockwave into clinic? How will it work? So our journey started 12 months ago when we were introduced to Katie. We were talking about what's the best Shockwave machine that we can use, and they were, super helpful in helping us choose the right machine. How would it fit in our clinic, and also the training needs as well that we'd need to start using it. So like I said earlier, we see many MSK patients in our clinic. We've got many useful assessment tools already. For example, the Run 3D, pressure plate analysis. We use customized insoles. So we're always looking at how we can improve our treatment options. And one of those things that we turned out was one of my colleagues, she used a lot of Shockwave on her clinical placement when she was a student over in Singapore. So we're always keen, and she was saying how her treatment outcomes and treatment, using the treatment on different things was so useful. over on a placement that we've decided to explore how we could use it here in clinic. So we really, like I say, we researched, spoke to Katie. We decided to invest in the Shockwave. But as with all new technology, what we don't want is just to bring something in and not know how to use it. You know, all the gear and no idea kind of analogy. So we always like to bring know how the research and training to make sure that we're using it effectively and also getting the best out of it and the best treatment outcomes for our patients. So one of the things we first did before we even started using the equipment was we did the online Shockwave course that is run by the PhysiQuip. There isn't many courses out there for Shockwave, if any. So this was really, really good basic knowledge to give us a good insight and the fundamentals of how Shockwave works. It's split into the 14 modules, so it's quite, bite-sized chunks. So it's easy to understand, easy to digest. And it also, more importantly, gave us a really good head start in gaining our confidence so that we could use the Shockwave effectively in clinic. It didn't look too much into how to treat patients, as in certain pathologies. It was more about the Shockwave machine itself and how it works in regards to looking at frequencies and strength and how it integrates so that we can explain that better to the patients, as in what the Shockwave's doing. So then we was like, okay, we've done the course, we've got the machine, what do we do now? So then we started to implement. So again, as with all new treatments, the easiest way for us to implement Shockwave was to talk to our patients about it. What we found is the easiest thing. So we have got quite a good mix of MSK patients. So it was just as, when we're discussing treatment plans, we can say, okay, now we've got Shockwave to add to your treatment journey and treatment pathways. Then patients are like, so what's Shockwave? That's when we can talk about it. We can tell them how it's going to impact them, depending on the condition. But what we also did was offer the first session of Shockwave free as part of their initial treatment plan. So they got like a taster session. Then they could then go away and decide whether that works for them, whether it benefited them in any way. And then from there, they would then make that informed decision as to whether or not they wanted to include it into their treatment package. The majority of patients do after they've had a session. We tend to suggest that you need 3 treatment sessions anyway before you start to see the initial benefits of Shockwave. So one session might not always be enough. However, as an introduction, as a taster, patients generally know whether or not it's something that they want to carry on with. So we found it really good to just, rather than just say, right, you need to invest in 6 sessions, just to make it easy for them to make the choice. They know what they're investing in, and we generally find that we have a better uptake with that. We don't try and tend to offer, when we do the Shockwave program, it's a standalone treatment. We always kind of integrate it with our treatment pathways as we've got now, as we originally had. So for example, we would do Shockwave with, an exercise program, some kind of rehab, whether or not they needed an orthotic, so that we don't just say, you need Shockwave and that's all we can offer. It's just, we've integrated it into our existing treatment modalities. Also, we've got the really strong links with local physios in the area, so that we can offer the Shockwave, they can do the rehab, so we can carry on our collaborative working in that way as well. All of it is just to make sure the patient's getting the best and the most effective treatment. And the Shockwave is just giving us another string to our bow to help speed up and help with the healing process. So when we then introduced Shockwave, excuse me, it's just, there's always going to be challenges. There's always going to be something new. Like I said, this machine's just arrived in clinic. What do I do with? And you can't just like get a machine and all of a sudden the patients are queuing up at the door to come and have Shockwave. you need to let people know you've got it. So our first challenge, as with all new treatments, was letting the patients know. And how do we let the patients know the treatment's available? As I was saying, for any new MSK patients that was coming in, we'd do the free taster sessions. But also we're doing it through social media as well, just letting people know what we do and what we've got. It's really difficult when you're doing your research around Shockwave as well, looking at practices in your local area, because a lot of people do offer Shockwave now. It's quite a common treatment to have, you know, physios, podiatrists, sports therapists. A lot of people do have Shockwave. So then you've got to kind of think, okay, so why are we different? Why would people come and, you know, want to have Shockwave with us as opposed to the local area? Especially because you're investing in a really expensive piece of kit. So, you know, how beneficial will it be in regards to competition? For us as a clinic, we don't view anyone as competition, really. We don't see competition. It's all about what's best for the patient. So that was quite an easy challenge for us to overcome as well, of knowing that our MSK patients will just be getting an extra treatment option, but it is worthwhile that you don't, you know, that you don't want to do something that everyone else is doing and kind of flood the market a little bit. It's just put another angle on it, make it unique to you. Like I say, we work with local physios, we work with therapists, so that we can create plans between us rather than trying to compete, because I don't think that's a healthy kind of way of looking at things, really. We always like to work with our local community. Also, then we was looking at move on to like research in the area of, there's a lot of research out at the moment. Obviously there's all the NICE guidelines that are saying how beneficial Shockwave was. So it's something that we weren't using in clinic. Yet there's this tool that's saying, okay, look at all this evidence that says it's really helping the patient outcomes. So it's obviously something that will benefit our patients. But also, just recently, there's been quite a lot of research articles being published that are kind of maybe saying Shockwave isn't as effective as everyone first thought. And we've just invested. So we were like, oh my God, there's all this research just coming out now saying it's not as effective. So where does this kind of leave you? So what we kind of thought was, okay, when you do break the research down, again, it's gearing towards that Shockwave as a standalone treatment. So integrating Shockwave as part of a treatment process, integrating it with your rehab, your orthotics, you know, your strengthening program, whatever else you may do. Shockwave is great as part of a treatment package. So again, not using it as a single treatment modality will help speed up treatment and have a positive benefit to patients. So again, another challenge when you look at how do you incorporate and let people know, let your patients know that you've now got the Shockwave? Marketing. So we do have all the social media platforms. As with every clinic, sometimes you're on it, sometimes you're not, depending on how busy you are. So in real life, you know, you like to have all these posts going out and keeping everyone informed. It's not always the case when you're busy seeing patients in clinic. So we like to keep on top of our social media. We're not brilliant at it, but we do like to highlight our successes. So rather than being more of a marketing as in, look what we've got, our angle is look what we can do. So that's more telling people about what patients have been successfully treated. I mean, we don't push this. We don't ask for like patient feedback and get them to pose with pictures with us or anything like that. They can if they want, but we like to just share our success stories of how we have helped patients. Again, we can always be better at it. We can always want to do more posts, but we do find a lot of marketing now. TikTok and Instagram are normally the big platforms for us, especially with the younger audiences. And Facebook tends to be more for the older population as well. They still use a lot of Facebook. I put myself in that bracket, but yeah, it's funny how you see different demographics of patients use different social media platforms. So it's knowing your market as well of who you're aiming at and which platform will give you the best results. And we have a wide age group of patients, so we kind of attack all platforms. But yeah, being aware of where you're posting is also quite important, and what you're posting for. For example, I know one of my colleagues who purely advertises through TikTok and gets all their work through TikTok. But I don't know how that would work in all of for all patients. But yeah, it depends on who you're aiming at, really, an age group. Okay. Oh, I was going to say as well with the marketing and implementation, one of the biggest things is patient recommendation and patients who've come into clinic. So that is why it's really important for us as well to offer that free taster session, because we're making patients aware of what we've got. We're making patients show that, we can show them what we can do, how it can be helpful in different situations, because everyone's got a different pathology, different condition. And not only that, it gets people talking about you, hopefully in a positive way, but that positive way that people are talking about you and how they will then say, you come to this clinic, it makes sure it gives you high standards of care, gives us a good reputation within the local community, and brings in more patients, new different patients with different pathologies. So word of mouth and patient recommendation is really, really important. So that's why, instead of having the machine, even having the machine next to you, and then say patients will say, what's that do? Then you can start having that conversation about Shockwave. I do, not all our patients are MSK. Some of our patients are, just routine patients, if there's such a thing. And they're just coming in for, say, just general foot care. In our room, we have the machines within sight. And a lot of the time they'll say, oh, what does that do? For example, we've got the treadmill and it's like, oh, do you have a run on your lunch? And that kind of engages you to talk about gait analysis and other treatments that you might offer. So the same with the Shockwave. If it's there and it's in sight, they'll say, what's that? You got a new bit of kit? What's that? And then you can start talking. So even just talking about it, whether they want it or not is a thing, but they might say, oh, my son has got this, it might be useful for him, or I know my friend's son that might, and it just engages conversation. And it's another way of introducing patients into clinic that may not have known what you offered and how you could come in the first place. So it's always useful maybe to have it in sight as well and not hidden away in a cupboard. So I'm just going to briefly talk as well about a case study of a patient that I've seen in clinic. Like I said, we've only been using it for just short of 12 months ourselves. So I've not got masses of case studies to share, but it's just so that we can see how I've been using it in clinic. We're still building our own confidence as well, looking at the protocols and working out what's best for each condition. So this patient I'm going to share, it's just a patient who attended for, she had bilateral plantar fasciitis, very common condition, long-standing history. The same patient, they've tried absolutely everything at home, gone through all the self-recommendations, looked online, done the stretching, foam rolling, ice, all the rest of it, but just felt that she needed that little bit of help just to shift the pain. At this point with this patient, I'd only had the Shockwave for 2 weeks. So she was one of our very first patients that we did Shockwave on. So I was like, great, I've got plantar fasciitis, I'm going to go for it and we'll do some Shockwave with her. So she was quite happy to get involved. So we did the first treatment. Patient couldn't tolerate it. She didn't like it. She was like, nope, it was too high. So again, it's that working out the settings. So we're still obviously working that out. So I just lowered the settings right down for her till we could tolerate. In fact, we went down to like a lowest of like a 2 bar. Did some taping, did a bit of exercise advice. Also, her footwear was shocking. So we talked about her footwear, and off she went for that after that first treatment. So she came back the second week and she was a bit, I'm not sure about this. The Shockwave, she didn't feel it had done anything, but when you actually talked to her, the pain wasn't there as much. The pain was still there when it came, but it settled quicker. So it was getting better, although on a scale of 1 to 10, the pain scale was the same. She wasn't getting it for as long. So she was still a little bit dubious, but she was happy to carry on. Then we also introduced insoles as well at this point. And then she came back for the third week. Pain had gone. And it was just like, what? And she was over the moon. She was happy. It had gone in the left foot, but the right foot was still a bit niggly, but she was walking. She'd gone back to playing walking football, which was her aim of where she wanted to be. Felt that she was a massive, massive improvement. And then we carried on after that and did another 3 sessions of Shockwave along with everything else, like I said. So we've always included in a treatment program, and she was really happy. And yeah, although the pain wasn't a 0, it was enough for her to carry on with her day-to-day and get involved in the activities she wanted to do. So with that being only 2 weeks in of having a Shockwave machine, when we started the treatment with her, I was like, okay, this is something that will help us. And we was really happy. Obviously, you don't get the same kind of response from everybody, so it is pick your patients. But yeah, it's just great that you see people smiling and just happy and getting back to doing their day-to-day, whatever that may be. So it was a really good success story for them. So then when you look at obviously bringing a new piece of kit that you're investing in into the clinic, as well as your patient outcomes, you've obviously got to look at it from a business point of view as well. So as a business owner, one of my concerns as well is if you're investing in this kit, it's a business at the end of the day. What's it going to bring to the clinic? So for me, obviously, I'm not all about financial gain all the time. For me, we're medical. So having the best treatment for your patients and having another string to the bow and all of, making treatment options better for patients was always the big driver for me. However, realistically, you've also got to make sure that it brings you the money in to be able to pay for the machine. So I found that just by introducing it as an extra treatment, it's giving us another road of treatment option that we didn't have before. So some patients do actually, do the research before and want Shockwave. So they do book in just for Shockwave. So it's that they wouldn't have come. That's another revenue stream for us. They wouldn't have come to clinic before that. So it does offer additional services, and so that's really good. But the main driver is having that extra option of a clinical tool, being able to add it to the bow of all your treatment options. It's boosted our credibility as a clinic as to what we can offer. It's definitely increased word of mouth and recommendations, because we're getting more people saying, yeah, go there. They might do this for you, but they've got the Shockwave, so they can give you a bit of everything and it's all included. So rather than going one place for one thing, place for another, we can kind of do it all under the same umbrella. And patients really like that we can treat everything. So just having that extra tool has definitely boosted our revenue stream and our revenue throughout from the last 12 months, really, looking at what we can offer. And that's me. So all done. Back to you, Katie.
Excellent. Thank you so much. That was really good. I really enjoyed listening to that perspective as well. So yeah, that was great. Thank you. So, as I mentioned, we do have a few pre-submitted questions to go through, but if you were on live, please feel free to submit some in the Q&A, and we can always answer those as well. So a couple of the pre-submitted questions we did get, first of all, was a few clinical questions, I would say, and you have covered a little bit about sort of plantar fasciitis. But with regards to your experience and benefits of using plantar fasciitis is the question. So I guess just to expand on that then, is that a very common pathology for you, Louise? Obviously you did sort of explain a little bit about your management in that particular case, obviously not using it on Shockwave on its own, using it in conjunction. Is that really the approach that you would use?
Yeah, so I'd say 90% of people that I've used Shockwave on would be for plantar fasciitis within my clinic, the patients I've seen. How has it benefited? Well, I've never used it on its own. I've always used it usually alongside some form of orthotic, but also rehab and strengthening. So again, just using it as a package of care, looking at the treatment protocols and the guidelines. I've just been using the actual guidelines that are recommended, the medical guidelines as to what the dosage should be for plantar fasciitis. I briefly kind of said I've adapted it for the case study, but that was because I reduced it just because they couldn't tolerate it. So yeah, if they can't tolerate it initially because it's too painful, then yeah, just reduce the dosage, and then I've adapted the pain as she can tolerate more. But I've definitely found the more I've used it and the more confidence I've got of using it, we've had better outcome with patients. Yeah.
Great. Perfect. One of the next clinical questions is that someone is keen to hear your management of tib post tendinopathies. Is that something that you see as well?
I'll be dead honest, it's not something I've done, a condition I've used it on. So yeah, we do get a lot of the tib post tendinopathy, but I've not actually used Shockwave on it yet. Like I say, it's still quite new. So yeah, that's maybe something I'll move on to myself. But unfortunately, yeah, it's difficult to answer that one if I've not done it.
Like you say, I think that journey of using any technology but Shockwave in specific as well, is that you're building your own confidence, aren't you, as well? And so utilising it is probably the most common ones that you see in, you bringing it in, you're developing that, and then, like I say, that's where the scope increases, isn't it, when you're getting those
absolutely
using other modalities for, but then you've got that tool now that you can hopefully develop and utilise at some point with it. It's all a part of the journey, definitely.
Yeah.
Do you use a pattern when leaving therapy source when treating Achilles and plantar fasciitis? I'm guessing that means that you're all in one movement when you're applying with the
treatment. One technique that I do like to use is, obviously, it's for those who use Shockwave, you know that when you hit the spot, that's when the patient kind of lets you know, because they jump and they'll say, ow, or I'll give you some kind of stimulus. But for me, the treatment process, what I would do usually is like kind of manually palpate the foot or the painful area just to see where it's the most painful point is. That's when then I'd use the Shockwave over that area, then move off of it, then move off it, move around it gradually. And that kind of confirms as well that you're on the right spot. And so then I just move the Shockwave head slowly around that area. And once I'm on the spot, I just hold it there, making sure that obviously the intensity is no more than it's about 6 or 7 out of 10. If it is, then obviously that's when you adjust your settings or move off the spot for a little bit. But yeah, I just hold it once I've located the spot and dish the pain.
Exactly that is it. It's definitely about patient feedback, isn't it? I think.
Yeah.
The patient, and that can differ from one patient to the other. So you might use a pattern, there's no, protocol as such, there's guidelines. So obviously that's clinicians in
No,
practice?
I just move the head. So I've located the pain first if I can, just by palpating with my hands, and then I just move the head of the shockwave onto that spot. But the patient will let you know whether they like where you're putting it or not. So, but yeah, so long as you keep with their pain
Yeah,
threshold, then yeah.
you do something right then. Okay, so there was a question about would you go with machine recommended frequencies when treating, or do you use different guidelines? We did touch on this before, didn't we?
Yeah, I think, but like, I'm going to say I'm no expert. I don't claim to be an expert at shockwave. I'm probably the same as everybody else out there, just kind of getting used to the machine, building my own confidence and in using it. So yeah, I refer purely to the guidelines. Stick with the guidelines. They're quite clear. They're quite easy to follow. There's different guidelines out there for all the different machines as well. But if you follow, they're all pretty much the same in regard to what pressure you should have on for a different condition, the frequency and the pulse. So yeah, stick to them. They all come, like, for example, we talked about plantar fasciitis. You're looking at like 2 to 4 on the pressure bar, and the pulses you're saying 2 to 3,000 up to about 10 hertz. So we kind of stick to that kind of bracket, but some patients might tolerate it at 4, the bar, some patients might only tolerate at 2. So your dosage as well is what your patient can tolerate. But so long as you stick within those kind of guidelines for each pathology, then that's what I would recommend to do, really. I don't really stray from the guidelines. I don't feel quite confident enough yet to. But they're effective and they're there for a reason. So yeah, that's what I would do.
I think that's a good point to take away as well, isn't it? Is like the guidelines are a good starting point, aren't they? Especially building your own confidence in treatments, and you're finding different patients respond differently. That's what guidelines, but that's not
That's what they're there for.
either. So, like I say, it's stray from the guidelines with obviously patient feedback and all your clinical reasoning surrounding that. But like I say, that it's a good starting point, isn't it, for people? And sticking to those guidelines as well is
Yeah.
a safe point for people if anyone is worried about,
Yeah.
energy frequencies.
And just document what you've done as well. So we have a protocol paperwork, so we can say exactly what prescription and dosage we've given to each patient for each pathology. So if we have adjusted, we'll obviously document that so that we can look to increase it as the more we see them. But also, you know exactly then what you've administered to each patient. So paperwork is also, record keeping is also really important as well as following the guidelines.
Yeah. Okay, so the next question is, are there specific patient populations that respond better to shockwave therapy? So would you say you've seen a range of patient populations at all with shockwave?
Again, I've not seen hundreds of patients for the shockwave, but I don't think there's any particular population that I've come across. I've tried it on a lot of different people from different backgrounds, different age groups. That's Some people have responded when you think they wouldn't, and some people haven't when you think they would. So I would probably say not really. I've tried it on, so long as they fit the criteria and they don't have any of the contraindications, there's no reason why you can't use a shockwave on them.
Yeah. Okay, great. Thank you. Just a couple more questions then to get through. How long does it typically take for a podiatrist to become proficient in administering shockwave therapy?
Yeah, I'll let you know when I get there. No, I'm only joking. It's an ongoing process. I don't think you could say, okay, tick a box now, I can do it. I'm very confidence conscious anyway, so I'm always learning. I'll always be reading around, making sure I'm doing the right thing, wanting to learn more. So yeah, it's down to the individual. Once you're confident and you feel that you can do it, there's no reason you can't just pick up the Shockwave and start using it. The guidelines are there, they're very clear, it's a very simple machine to use. You only literally have to point the machine at the patient. There's not much that can go wrong with it. So it's down to the individual's confidence levels, really. Like I said, I wasn't confident to use it till I'd at least done the online course, just to know what Shockwave is and what I was actually doing to the patient. So yeah, there's no reason you shouldn't just have a go, obviously.
Yeah.
And yeah.
Definitely. And I think with podiatry as well, because I think what we experience talking to maybe podiatrists is because you're so specific in maybe the area of the body that you're using as well, that does narrow down maybe the application use as well, compared to maybe a physio clinic who using Shockwave and they may think, they've got, they can be using it, they're seeing patients where they can use it elsewhere, for example. I think maybe there is an element of, let's say, a podiatrist just going on that journey as well, just actually understanding the application for them MSK patients, but you still get through in podiatry, don't you? I think, like I say, it's very important that you do get MSK through podiatry clinic, because it's not just physio.
Yeah. So yeah, it's down to your confidence and doing it on the right patients. Yeah. And I'm sure everyone can use it. I mean, my confidence, I need a lot of encouragement to get my confidence up. So if I can do it, anyone can. Yeah, that's what I'd say. Have a go.
Okay, so this question, what insurance or reimbursement options are available for shockwave therapy treatments? Is that something that you're aware of with regards to sort of insurance bits in clinic?
So the insurance.
Yeah.
I Is that insurance as in being insured to use it, or insurance as patients having insurance?
I think it's more from a patient insurance perspective. So like the options for maybe clinics down that route. I don't know, let's say some clinics have that experience, some people don't, do they, with insurance patients?
Yeah, so we do we do see all insurance patients. I know a lot of clinicians probably moving away from that now, and I've never had a problem. Even when we've introduced Shockwave, we just do it as a review podiatry appointment, and like I said, we incorporate Shockwave into our follow-up appointments. So we don't specifically say it's our Shockwave treatment. It's the patients come in for our podiatry follow-up, and in that follow-up they've had Shockwave. So as from an insurance point of view, if they know they're coming for a podiatry review, then that's what we class it as, really. I think there are a few insurance companies, if you were just doing Shockwave, it'd have to be done by a physio, not a podiatrist. So I don't know, that would be down to the clinician to arrange that with their insurance company. But I do know that they do. A lot of insurance companies would rather it be a physio than a podiatrist for some reason. But if the insurance companies have agreed to podiatry follow-ups, we could do Shockwave in that, but we always let them know what we've done, obviously in the treatment records. And so, yeah, I think it just depends on which insurance company you're dealing with.
Yeah, of course. That's a good insight. Thank you. We did get a question come through live, but it's more product focused, just asking about differences of shockwaves outside of the UK. So for this person who's done anonymous, if you want to send us VisIQuip a message about that, and we can answer that one separately. That'll be good. Okay. And then the last question we've got for you, Louise, because you've covered some really good points in the presentation, to be honest. And this one as well, you did mention someone asking about marketing Shockwave and your services, I guess, to new and existing. Like I say, I think it was really nice to hear that, like I say, you focus a lot of what you communicate is what you can offer as a clinic, your success stories, you're not promoting that, and it's the best way to communicate, I guess, with your patients, isn't it?
Yeah, so from a marketing point of view, I say talk about it in clinic, have it on display, let people see it. So let the patient guide the conversation. So don't just kind of, patient sits down and go, guess what? I've got a new toy, and start telling. It's if they show an interest, then I jump on it, and it also fills the conversation of the treatment as well. So if a patient shows you an interest, talk about it. They're obviously intrigued. And that guide, like I said, it might not be for them. We get a lot of the elderly population that wouldn't need Shockwave, but like I said, they might go, oh, my grandson, my son, my next door neighbour, he's got this, and this. Would they be useful? So yeah. Do talk about it. It doesn't matter who to, because you don't know who they're going to talk to on the bus on the way home, or so word of mouth is good. And social media, like I said, choose your platform wisely, depending on what you're trying to achieve. But we get a lot of success on Instagram for the younger people, and the older people is Facebook. That's just us personally as a clinic. That's what we tend to find, as who responds on which platform. So depending on your patient demographic, don't waste your time on one social if you're going to get more off the other. That would be, especially if time's an issue as well.
Yeah. And also from your perspective as well, obviously some people in clinic think, how to market their, treatment offerings or anything like that. It's like trying to get content, I guess, from the use of that in clinic. And I find that quite challenging, because we have sometimes feedback, because it's hard, isn't it? You've got patients in front of you don't want to be getting a camera out particularly. Is there sort of, ways and challenges that you've experienced with obviously trying to show?
Yeah, that's what my family's for.
Yeah,
so, a lot of my pictures, disclosure now for anyone who's seen them, it's probably my mum, my children, my husband. Yeah. So they're not necessarily the patient that we're talking about, but unless some are. But like I said, yeah, it's really difficult. You're in clinic, you sat there, you've just done really well, and you're going to turn around and say, do you mind if I take a picture for social media? It just looks a bit, yeah, so I might choose the story and a little bit of poetic license in using the picture that goes with it. Because not everybody wants to be shared on social media, but you want to share your success. So yeah, some of my pictures are family and friends, and even each other in clinic, but the stories are true. It's just that we've just put a different picture.
Yeah, and I think that's a for starting point for people advertising, marketing in clinic. Like that's, like I said, you feel more comfortable doing that, don't you? Like getting those pictures from peers and things like that. But
yeah,
eventually who will be really onboarded with, the program, and then receiving Shockwave, and just ensuring that they're comfortable with, like I say, getting a picture and being able to share. Then that builds, I think, doesn't it? As you've got your patient good, and you pick and choose your patient, like so you've got to respect
that. Exactly. Some love to go on socials. They ask to, when I'm like taking pictures of the patients I've known for a while. Not necessarily for Shockwave, but for something else. And I'll go, don't worry, I won't put your face in it. And they just go, you can if you want, it's fine, So yeah, some people do actually want to. So it's just picking the right person. Yeah.
I think that's good as well, because like I say, it gives people a bit of faith that you can develop that marketing with your patients and getting your patients on board as well. Like it is possible, but some people understand it's hard to, where do you start with that? And like I say, it's good feedback from you there. And start with your family, start with your, get that content out there with how you feel comfortable getting those pictures, and it'll come, won't it? So
yeah. But yeah, just pick on people that your family, your friends.
Yeah.
Just get some content, that's all. Some pictures.
Yeah, excellent. Okay, I think we've managed to get through all the questions, and that's all the questions through live as well. So yeah, thank you everyone for joining us, and thank you again, Louise, for presenting us for today. That was really, really useful. So thank you for your time.
Thanks for inviting me. Thank you.
Thank you. So following today's session, everyone will receive a link to the webinar recording for those who couldn't make it live. And if you do want to get in touch with us about Shockwave or any further education, we are running in-person workshops for Shockwave in Manchester and London. So we've got dates on the website, and we've also got the online Shockwave course as well. So there's opportunities there. If you do want to discuss them with us, then please get in touch. So thank you again. And Louise, thank you again. I'll let you have some lunch now. Lunch.
Thank you.
Yeah, so thanks everyone, and have a good rest of the day.
Thanks. Bye.